do today is kind of do a bit of an intro of actually how I got to where I am now at ESRI Canada. I started at U of T actually, so I'll kind of give you a bit of that story. Maybe I didn't start there, but I transitioned from U of T. And then I thought I would walk through some of the examples of the things we're working on and some of the projects we've been building out, but also leave some time, a lot of time actually, at the end to just also have an open discussion and really talk it out. Also, feel free to interrupt me as we go through. If you have any questions, happy to keep this as dynamic as possible. So let's see, here we go. Oh. Maybe this is, there we go. So yeah, I guess I can definitely speak to the whole like academia to industry transition. I don't know if I even anticipated going through that process, but it's sort of what happened to me ultimately. I definitely started, I started at McGill as an undergrad. I was in the School of Environment, kind of did environmental sciences. Slowly specialized more in this health stream, which was a lot of, environmental health and even, getting into infectious disease research and that kind of a thing. So that was, it really piqued my interest in my undergrad, and I transitioned from there to do my master's also in health as well. But in my undergrad, I started to get into this methodology and this technique of using maps and GIS, the Geographic Information Systems. And I don't know what it was. I guess I've always been a map person, really into it. It's kind of visual, it's kind of cool. So that became this sort of like common thread through everything I started to do. From my undergrad, my master's I actually did in geography at the University of Calgary. Also still doing infectious disease research, but it was using maps and using spatial modeling to help understand the role of location and the role of geography in how disease systems function. Oh yeah, this is again another sort of background in GIS. So maybe some of you have had exposure to GIS, maybe you use it, maybe some of you are experts. But for those who are less exposed, GIS is really a whole system. It's these kinds of systems that are really all about data. So I think a lot of people think, oh, GIS is that software you can use to make really nice maps, really pretty maps, or maybe even map dashboards. But at the end of the day, what's really going on is it's a whole system to create or sample, to manage and analyze, and ultimately map and maybe communicate all different kinds of data. So eventually I said earlier, I did some work at the University of Calgary, but I came back over to Toronto. I did my PhD here at U of T, honestly just up the street at the Department of Ecology and Evolution. And everything I did there was all about infectious disease ecology and understanding the role of our landscapes and our climate change and land use change on the emergence and potential exposure risks, in this case actually of vector-borne diseases. So this is just one little snapshot of my PhD work. We use GIS, of course, to look at this role of our landscape structure. So we call that habitat connectivity. It's kind of like the configuration and even the composition of our landscapes, especially our forests, and how Lyme disease can invade and ultimately establish in Canada. So this is some work that I did with the Public Health Agency of Canada, actually. Again, using GIS for understanding our Lyme disease ecology. Again, also use GIS to understand, looking at sort of patterns of wildlife parasitism, so diseases that naturally occur in wildlife. And we looked at this across Southern Ontario to sort of see, again, along this urbanization gradient, some of our more urban wildlife populations tend to have a higher diversity of parasitism, at least in southwestern Ontario, than those that are more rural or more remote. And finally, so this is another sort of part of my story. After my PhD, I had some connections just through research partnerships, and honestly, I think I came to some fields workshops as well, made some connections with the School of Public Health that I was not working on in my research, but just sort of wanted to make those connections. And that actually led to getting a position at Blue Dot. So some of you might know Blue Dot, the startup here in Toronto, sort of using artificial intelligence and data-driven approaches to global infectious disease surveillance. And because at the beginning, basically when I was leading my PhD, it was the beginning of the Zika epidemic, they were looking for somebody who, of course, was using maps and GIS because that was a big part of what they did, but also had that background in vector-bornes. So long story short, one of the pieces I did with Blue Dot, and this is actually in collaboration with the United States CDC, was to look at areas in Latin America where we saw there was more or less suitability for Zika virus transmission. So we ultimately modeled out using spatial analysis specific elevational gradients beyond which, just based on those factors, those suitability factors, we could assume that Zika virus transmission would be very limited. And the idea there was that it was ultimately to reduce these air travel bans across Latin America that happened at the beginning of the epidemic, Zika epidemic, to prevent the importation of cases back to the United States. So this actually influenced policy, and this was sort of the first foray for me to work, working in industry, working at Blue Dot, but at that point to really work with public health agencies, especially the United States CDC. So it's the beginning of the exposure of not just working in academia, but getting more experience working with partners, working with researchers, and working with industry. But after this, I was at Blue Dot for about 6 years. And then, of course, it turned into, from Zika into COVID. We did a lot of COVID support at Blue Dot, but through that experience, ESRI, so here I can go to ESRI Canada now, we're really seeing the potential to use GIS, or really honestly expand the use of GIS in Canadian public health. And so they started to really invest in more, honestly, subject matter experts who understood GIS, but understood public health as well, especially surveillance in the midst of the COVID pandemic. And so, yeah, they started to build a team out, and they had connections with Blue Dot. They reached out to me to see if I had interest in sort of joining this team. So that's kind of how I got to ESRI Canada. And maybe now I'll just give you a bit of introduction of what the company is and what we do. So ESRI is actually an acronym. It stands for, as far as I know, Earth Systems Research Institute. I was second guessing myself outside. Is it Earth Sciences Research Institute? But I'm pretty sure it's Earth Systems. ESRI itself it started in like the 60s in California, in Redlands, California. And it was really about sort of land management, land resource management, mining and forestry, that kind of a thing. And of course, it kind of blew up into this company that it is today. So ESRI Canada is a software distributor of ESRI software. So ESRI is like the fundamental business that is, it's the primary company that is in the United States. And ESRI Canada, like so many other, there's ESRI UK, there's ESRI Colombia, there's ESRI, Argentina. ESRI Canada is a distributor of that software. So that's really ultimately what we do. And so, when we think about what ESRI is specifically, it's really kind of the global leader, or considers ourselves the global leader in GIS. I think some of you, including myself, may have used more open source GIS platforms. There's like QGIS, and I'm not sure if GRASS still exists, but there used to be one called GRASS. You can use R, of course, for a lot of different spatial analyses. But in terms of an actual proprietary GIS system, ESRI and ArcGIS is really sort of that primary platform. We do a lot of strategic partnerships with major companies, Salesforce, Microsoft, and even Amazon in some cases. But it really is sort of the go-to GIS software. We call it ArcGIS, and I'll show you that in a second, for a lot of institutions. And this includes the Canadian government as well, federal, provincial, and local levels. So maybe some of you have ArcGIS training. It's sort of kind of a pretty common interface that a lot of us use. And even for myself, in all of my undergrad, master's, PhD research, I really relied on ArcGIS, even as a student. So yeah, ArcGIS, this is kind of our bread and butter. Honestly, it's everything we do is based on like all of the different products that exist in this huge ecosystem that is called ArcGIS. I used to think it was just one thing called ArcGIS Desktop, which is what I used, but there are so many different products and software that exist in it now. So I like to think of it as sort of a system of record, and that's really a sort of system that allows you to integrate data, collect data in some cases, integrate that data into one system, a lot of data management opportunities, even automation these days in terms of how we can bring data in. So really that system of record is sort of the bedrock of ArcGIS. Then there's that system of insights, so the ability to take that data and then really learn. So sometimes we refer to this as location intelligence. It's taking this data and looking at where do we see patterns of disease in some cases. Where should we place the next Starbucks? This is another major use case. Where should we, in my world, where should we locate another homeless shelter? What would be ideal if we used housing data to predict where we're anticipating an increase in houselessness or homelessness in the future? So all of the opportunity to perform those sort of robust, geographically driven analytics and modeling, honestly, in a lot of cases. And then finally, I think of it as a sort of system of engagement. So I'm not sure if some of you might remember these map dashboards that really came out through the pandemic, these COVID dashboards. We can really use this same system to use maps to communicate these analytics, communicate these insights, and in some cases inform policy or to support, to inform decision support. In some cases, again, it's business planning, right? So lots of different ways you can still use that same software and use these same maps to help communicate to teams. I put this up. I think it's kind of boring, but maybe this is a sense of just what the company is. So this is ESRI Canada, not ESRI Inc. But it was founded in 1984 by Alex Miller, who's my boss. He was started in forestry. Oops, I went backwards. Here we go. He started in forestry at UNB, I think, in the 80s. He was good friends with Jack Dangermont, who's the head of ESRI Inc. And so he and his wife actually started up ESRI Canada. We've got lots of different customers, over 12,000 customers sort of working with us. It's around 500 employees, give or take. There's a main office here in Toronto. It's at the DVP in Lawrence. So I go in about once every 6 months or so, maybe once every 4 months these days. But otherwise, there's offices really across the country, like Halifax, Vancouver, Calgary. Most of our major cities have smaller satellite offices because really the employees are really distributed across the country. Lots of business partners, a lot of investment in R&D. So we're always kind of thinking back to research or development, whether that's in-house, but probably more so with our partners themselves. Yeah, a lot of commitment to sort of sustainable growth and a lot of nonprofit support and social sort of benefit partnerships as well. Oh yeah, and actually this is sort of what we've got. So lots of community support. We actually just kicked off our annual United Way sort of, I guess, projects, sort of an annual project. We've worked with the Missing Children Society of Canada, Trans Canada Trail, Ducks Unlimited. We're just working now with Pallium Canada, which is a nonprofit trying to actually increase training in palliative care education and services across the country. So lots of different community support opportunities as well. I thought I'd sort of break down just to give you a sense of who's there and where they came from. So yeah, when I think about the employees at ESRI Canada, yeah, I would say 90%, maybe 75%, I'm not sure, do have some training or some experience, some familiarity with ArcGIS, or even honestly GIS in general. So a lot of folks do really come from departments of geography, whether it's undergrad or in some cases masters and PhDs as well. Environmental science, as you can imagine, a lot from engineering, whether that's computer science and computer engineering, or it's like environmental engineering and people who are more involved in mining or oil and gas and resource management. But as you can imagine, because the company has grown so much, there's a lot of folks who are coming from more of a marketing background, more of operations and management background as well, who really contribute to everything we do. In fact, a big part of what we're doing these days is working with the marketing team to help promote the work that our customers are doing and really show maybe spotlight some of the really great and innovative GIS tools that are being produced, in my case, by the public health customers and research groups. When I think about the roles as well, if I really break down the company in terms of what we're doing, it's still a software company first, which means that there's a lot of salespeople. It's kind of all about selling the software. I can't deny that. So in that case, there's a lot of account managers, a lot of sales reps. It's split into 6 different regions. So there's like the Pacific region, Prairies region, Ontario, National Capital region, Quebec, and the Atlantic region. And so within these regions is sort of almost these little regional companies that exist as part of ESRI Canada. So that sort of consists usually of these account managers, these regional directors, and those kinds of folks. But we still do at ESRI Canada have teams of developers who maybe come from more of that computer science background. We're increasingly bringing on data scientists in bits and pieces, people who have that sort of AI background, because slowly but surely are we now in developing what's called geo AI, so sort of geographic AI. This is really just looking at using AI to automatically identify patterns in spatial processes. And so we're not quite there yet. Well, I think they'd like to think that they're there yet, but we're not quite there yet. We're on the way in terms of really including the AI, honestly, algorithms in the ArcGIS platform. But we're slowly sort of building that out. I think it's also important to note that it's not just about these sales teams in the regions. We have these sort of cross-functional teams as well. So something that's important, we have like an education and research team. So we have a lot of partnerships with most universities and colleges across the country to have basically providing ArcGIS, not quite for, maybe it actually kind of is almost for free, to ensure that students have access to ArcGIS in their research and that they understand how to use that system. So that they go off into the world, wherever they're working, they're comfortable with the ArcGIS platform. It's kind of the same as like getting training in Microsoft Office. Like when you leave, you should have those fundamentals and knowing how to use PowerPoint and Word and Excel, that kind of idea. So our education and research team is great. They really help support research groups using GIS and help students enhance their spatial skills as well. And then even for myself, it's interesting. I actually work on what's called the new business development team. And these are sort of like new innovative areas of where GIS can be applied in the world. So actually, maybe I'll just go to the next slide in that case. So within this new business development team, I'm sort of the head of public health. And slowly we're actually kind of transitioning this. We started as a public health team because it was really about helping surveillance and spatial epidemiology work that was happening during the pandemic. But this is evolving more so now into healthcare as well, primary care, acute care. We're seeing more interest in doctors and health systems leaders to use maps to help inform how to provide better services to patients. How can we measure understand a patient's community context or the social determinants of health, so that there's sort of a social prescribing that can occur. How can we? Oh, not sure what's going on there. No, okay. Oh, okay. It sounds like it's coming from there. So lots of different ways. There's a real expansion now of using maps and GIS, not just public health, but really across the board. This is my team. So I'm sort of the head of this team, but we've got Miriam, who's a technical solutions specialist. So she is like my GIS guru, but she also comes from a GIS and public health background. She worked at Montreal Public Health for like 10 years, I think, as their GIS analyst, and now is the one who can just do the most insane custom, like dynamic interactive maps. And she's ongoing doing training in Python and automation. She knows ArcGIS inside and out. So she really comes from this public health background, sure, but has really now taken on that technical component. Brian Mosley actually also comes from a GIS training, so he's a GIS professional, but he worked at KFLNA Public Health I think also for 10 years or so, actually with Kieran Moore when he was the Chief Medical Officer at Kingston. So also comes with that sort of combined GIS and public health background. And then Kieran Petrusek, who's our health geography lead. Kieran actually has a very similar, we have the same undergrad specialization at McGill, so ecological determinants of health in the School of Environment. So he, believe it or not, was also at Blue Dot with me. The two of us were at Blue Dot, and we also came over to start this public health team at ESRI. Kieran, yeah, he also has that background in GIS and more ecological health research ultimately. So this is my team, and we really kind of have these mixed backgrounds to help. And basically, we help build capacity within public health, healthcare, whatever it might be, health research to expand GIS. So maybe what I'll do is I'm going to just maybe quickly, honestly, go through some examples. I've got some extra slides here, but I'm not going to go through in too much detail. So our whole philosophy, of course, is that when it comes to health, location really matters. I think this is pretty intuitive when you think about the spatial dependence of infectious disease in a lot of cases. But we can also think about, where do we have access, barriers of access to health? Where do we expect disease is going to occur with climate change, for example? Lots of different ways we can think about location is really important in our health, understanding our health systems and how we can help with changes in policy as well. I think a lot of you might remember this Johns Hopkins COVID-19 dashboard. This popped up, I think Lauren Gardner, she developed this at Johns Hopkins with her grad student who is, I think he actually maybe worked at ESRI. So they pulled this together again using ArcGIS, using that GIS platform. And this became this sort of like relied upon daily, I think it's maybe the most viral map dashboard ever as far as the numbers are concerned. And it makes a lot of sense. A lot of people relied on this on a daily basis for COVID dashboards. So we really saw like a proliferation and an expansion of the use of these maps in health throughout the pandemic. This is a cool sort of, it's not even a dashboard actually, this is just a workflow within ArcGIS Pro, so it's the analytical tool. So we did a lot of forecasting and modeling. This is down in the States. I think this is maybe Tennessee. But the idea here is actually, taking these forecast models of surge capacities at emergency rooms and in hospitals and mapping this out. So if we look county by county, where do we anticipate over time we're going to see higher surges in emergency rooms. So this is, a bit more closely to the mathematical modeling that occurred and how we were able to use maps. This wasn't a full-on relied upon tool, but this helped inform state level action, just in terms of like, okay, we don't have many people, we don't have that many resources, we don't have much time. So where can we like target our response and our actions at specific locations first? How do we prioritize where we do that? And so this is an example of some of that work that was happening then. Yeah, we also are starting to see these maps, these models, these dashboards, helping build more trust, honestly, with not only with the public and with the community, but between levels of government. And this was really tricky, right? Especially in Canada, because we have this decentralized public health system. We have a lot of silos within public health. Honestly, the silos between departments in the same jurisdiction in public health, it's a real challenge. So we started to see maps being used to help build that trust with the public and build that trust within governments. So this is some examples of some of the wastewater programs we've been supporting. This is one in Colorado. This is just a public dashboard showcasing the prevalence of SARS-CoV-2 and RNA samples within their wastewater systems. So people can just readily walk into this. They can review over time where we've seen changes in prevalence, and that can be, you can zoom into specific counties as well to check out that location. Same with some of the opioid work we've been supporting. This is in Tempe, Arizona. Same idea. You can look for any samples that have presence of fentanyl or heroin, even codeine, and you can zoom into specific areas as well. So you get the idea. And this is just one last example we've been doing. We just built this with Newfoundland and Labrador. This should be a little video. And same idea, within Newfoundland, they wanted a system for the public that you could just walk into pretty easily, maybe it's not going well. And just look at the presence of SARS-CoV-2 in a given location. So I've got a lot of examples here, but I'm wondering for time if it makes sense for me to maybe open it up if you have more questions about ESRI and my role there and that